doctors group says the rise in cases is felt on the ground in hospitals. Let's check on the situation in one of the major hospitals here in Metro Manila. Joining me now is Dr. Benjamin Campomanes, External Vice President and Chief Medical Officer of St. Luke's Medical Center. Great to have you with us, Doctor. The Philippine College of Physicians told CNN Philippines A New Day earlier today that the increase in cases is causing a lot of worry among medical frontliners. Let's listen in to what Dr. Marica Limpin had to say.
So we used to only see about one, and sometimes, the positivity rate is really just around 1 or maybe 2%. But right now, there were even days wherein, like let's say we see 10 cases, and then out of the 10 cases, we see 5 of those people turning out to be positive.
Now that's Dr. Limpin there, essentially saying more COVID patients are again being admitted following an uptick in cases. Doctor, are you seeing the same in your hospitals?
Yeah, thank you for having me, Dave. I will talk about data, and the data we have is as of December 29. What is interesting is that we had our ER COVID positivity rate is 42.16%. It means that for example, we had 76 patients coming in as suspected COVID in the ER, and 82 of them, 43 turned out positive, 39 negative, and 8 were admitted. So the one that is very telling is the ER COVID positivity rate, which is 42.16%.
Compared with the numbers before the holidays, Doctor, how many suspected and confirmed COVID patients have been reported, at least in St. Luke's, in Quezon City, as well as in BGC?
In Quezon City, we even had a zero. We had 0 COVID patients for a while, since about 3 or 4 days ago. So now we have 8. In BGC, we previously had the lowest number was 3. We have now 17 admitted. We saw 73 in the emergency room today, and 9 turned out to be positive. So what is interesting is that, of course, we only admit moderate to severe patients. So most of these patients are of the mild type. So I think maybe the vaccination is doing well, because as you well know, vaccinated people they prevent hospitalization.
That is somehow comforting to hear, Doctor. But on another related topic, statistics have also shown that firecracker-related injuries have doubled compared to last year's, when most of the country was under stricter lockdowns. How is your hospital gearing up for a potential surge in firecracker injuries now that more people are up and about, plus the fact that we are also keeping an eye on a possible spike in COVID cases?
Yeah, we're always been ready we have an acute trauma team that's always ready for any emergency, especially for firecrackers. But as of now, we've not had too many of those cases in the emergency room.
Doctor, it appears that children are the most vulnerable now. Not only that they have yet to be vaccinated from COVID, previous years' figures have also shown that a significant number of children become victims of firecracker or firework injuries. What advice should we put out there for parents and guardians of these kids?
Of course, we always say don't let the professionals take care of the fireworks. There are a lot of LGUs and organizations that will take care of the fireworks for you. You don't have to do it yourself. And of course, it gives at least some safety to the kids out there.
Doctor, not only are we still confident on the nation's testing capacity? This is amid reports that some labs are no longer consistently turning in results, or worse, no longer operational. Or do you get a sense that less and less people are getting tested compared to the past months? Like you said, that there are cases possibly milder sila, walang symptoms, they can be asymptomatic, and possibly they are not aware that they could be infected with the virus.
Yeah, well, I have no data as to what these laboratories are doing. but we've never stopped testing in our hospital. And I have no data on the other laboratories, whether they've stopped testing or some of the patients don't like testing anymore. The problem is, what I see is there is a lot of people doing the antigen test, and if they turn out positive, they don't report this anymore. So that becomes a problem.
You mentioned about antigen tests, doctor. What do you think about at-home tests, which are very common now abroad, particularly in the US? In fact, they are running out of supply. Do you think we should also have that here in the country?
Yeah, we do have antigen tests. The problem with antigen tests is they're good if you're positive, but if you're negative, they're not very specific. So very sensitive. If you're positive, the chances are you are really positive. But when you're negative, you're not sure whether you're negative or not. That's the problem with antigen tests. And as I mentioned earlier, when people get positive in antigen tests, they just quarantine. They don't report this anymore. So there may be actually even more patients who are positive that we don't know, because these are not reported anymore.
Thank you very much for your time, Dr. Benjamin Campomanes, the External Vice President and Chief Medical Officer of St. Luke's Medical Center. Thank you for joining us.